do you know about cervical cancer or cervical cancer, depending on who taught you English, right? Well, we know that it is one of the killer cancers for women in Ghana, and today we'll find out why. So let's talk to our resource persons. Dr. Kalsum Zakaria Adam is a public health practitioner and the national coordinator for the Medical Women's Association of Ghana. And Dr. Anita Tibo is a family physician at the Korle Bu Teaching Hospital. Good morning, and welcome to Breakfast Daily. Right, cervical cancer. Many might be surprised to know that it's actually killing a lot of young women. Talk to us exactly what cervical cancer is and why it's such a life-threatening disease.
Okay, so cervical cancer, it's cancer of the cervix. So the cervix is the mouth of the womb. So the mouth or the neck of the womb. So it's the part of the womb that sort of joins the part of the female genital tract that joins the vagina to the uterus. Yes, and so when you have cervical cancer, it's a cancer that affects that area. And obviously because of the fact that it's a cancer, it can spread. Yes, and so when it spreads to different parts of the body, then you are going to have disease that is not curable. So when it's not spread yet, when we are able to catch it in early stages, it is curable. Okay. But the whole thing is that we have patients presenting very late. And by the time they are late, they present, it's spread or it's become complicated. And so the effects of that are fatal, or it severely destroys their quality of life, yes. Right. And so that is why we are making so much noise about it.
Now, Doctor, with many cancers, we might say, oh, no one really knows how they come from or how they spread, where they come from. But with this, it's often called a sexually transmitted disease. Why?
Yes, okay. So cervical cancer, yes. I would say nearly all cervical cancer is caused by HPV virus. So HPV is human papilloma virus, yes, which is sexually transmitted. So HPV virus, we have about over 200 types, but then over 40 of them are sexually transmitted.
Okay.
And out of even the 40, we have the high risk group, and then we have the low risk group. So the high risk group, most of the time we have the type 16 and type 18. And then the low risk group, we have 6 and 11. Okay, there are others.
Okay.
But the high risk group, most of the time when you get infected with this high risk strain of HPV, you tend to have higher or greater chances of getting cervical cancer. Mind you, cervical cancer, HPV, most of the time when you get the infection, it clears.
Okay.
So in 90 years, it can clear on its own. Okay. 90%. Sometimes it takes about 2 years and then it clears.
Wow. Years.
Okay. Yes.
So it can just be in there.
Yeah, it can just be.
Right?
Yeah,
so it can just
be in there, you know. Okay. But it clears. Your body, your immune system is able to clear it. Okay. But then when you get infected with this high risk types, sometimes it persists. Okay, it persists and it can be there for as long as 10 years, as long as 15 years sometimes, as long as 30 years.
What?
So you see, that is why we are emphasizing the need for screening.
Okay.
It's only a pap smear or other modalities of screening that can tell you that, okay, you have this persistent infection of HPV and you need to do something about it. And then we stop the progression of the disease.
Okay. Now, what about age groups? Is there any particular age group or age range that's more susceptible to contracting the HPV or developing cervical cancer, or is this something that can affect a woman at any age?
So it actually affects women who are sexually active.
Okay, regardless of your age?
Most of the time. And then one of the risk factors is having started involving yourself in sexual activity at an early age.
I see.
So it means that you have exposed your cervix to the HPV virus. You get it? Yes.
Okay.
So most of the time, once you're a woman, you have a cervix and you are sexually active, yes, you have the risk of developing cervical cancer. And it is preventable. You see, it is one of the topmost killer diseases in Ghana or in this part of our developing world. You get it? but it is preventable. So why would you wait and die from such a preventable disease?
Okay. Let's talk about how it can be prevented. So aside using a condom or using protection when having sex, is there any other way to protect yourself from contracting HPV?
Okay, so first and foremost, as a cancer, there are certain things that we can do. So a healthy lifestyle. So drinking alcohol, smoking, a sedentary lifestyle, which means you are not exercising much. Those are the general things that you can do to prevent, to reduce your risk of getting any cancer. Then for cervical cancer as a sexually transmitted disease, safe sexual practices. So it's not just about condom use. Being selective about your partners is also very important, because for women, we tend to get the infection more frequently because of the nature of the sexual act. We are sort of receptive, yes. And so a woman who sleeps with a man who has multiple sexual partners is putting herself at a higher risk than a woman who has a single sexual partner who does not have multiple sexual partners. So being selective about your sexual partners is also extremely important.
Okay.
And then the screening. So the screening makes sure that the disease is picked up at early stages. So when you go routinely, so for some of the modalities it's every 3 years, for some it's every 5 years. So if you go every 3 years and we keep checking, as soon as something different is noticed, we can do something about it and then halt the progression. And so generally, a healthy lifestyle, safe sexual practices, and then screening are what we can do to reduce our chances of getting the disease.
What about the HPV vaccine that we've heard so much about?
Okay,
Yeah,
so
tell us about
HPV
that.
vaccine, yes, it's available, and most of the time it's recommended by WHO that when you are between the ages of 9 to 15 is most effective. So for girls, so all girls, actually, even in the developed countries, it's actually compulsory, and they have a vaccination schedule for all their girls. So from 9 years to about 15 years, you can have the HPV vaccine given to you.
Okay.
And it doesn't also, I mean, you can also have the boys being vaccinated as well. Yes.
Same age range?
Same age range.
Okay.
And so if you are between the ages of 9 to 15, you need just 2 shots. And then if you are beyond 15, you need about 3 shots for the vaccine.
And has it been proven to
Yes,
totally
so actually I was reading an article which was published, I think just yesterday or so, concerning Canadians and then the US. They've actually seen a very marked drop in the incidence cases of their cervical cancer. And this as a result of the vaccination programs they have rolled out in their countries. And this is something that we can also learn from. But the challenges here may be the finances, and
it
also,
isn't free.
Yes, it's not free.
It costs quite a bit.
Exactly. It's about currently it's about 700 cedis per shot.
Really?
So that is the
For
challenge.
something so life-saving.
Exactly.
And that's sort of dovetails into one of the things we want to talk about, that it needs to be on the National Health Insurance scheme.
Exactly.
Cervical cancer screening management is not on the National Health Insurance scheme.
Because it's a top killer as well.
It's a top
right?
killer,
So
yes.
So it should be a priority.
Yes, so it should be a priority. So we are also helping out with the advocacy, yes, and we are hoping that we are going to get the media joining us, yes, to
Exactly.
advocate for putting it on the
And all
National
other
Health Insurance.
stakeholders
Yes.
Okay.
to come on board and then help make sure that we have cervical cancer screening, cervical cancer vaccination on our National Health Insurance,
Okay.
which would help us to a very, very large extent as ladies. Yeah.
And
Yes, go ahead.
to add to that, when Dr. mentioned the fact that it can be given to boys,
Yes.
yes, so the vaccine can be given to boys. It's not just cervical cancer is a disease for women, but because of the fact that it's sexually transmitted, it means that men, yes, can spread it around. And apart from the fact that they can spread it around, there are also certain, she mentioned the low risk and the high risk. Some of the low risk viruses actually cause oropharyngeal, and other anogenital cancers, which can happen in men. And with oral sex and all that's going on, men can also have those cancers because of the HPV. And so the safe sexual practices should also be practiced by men because they are also susceptible to other cancers from the HPV. Yes.
Are there any signs or symptoms that a woman may develop to give an indication that she has this, or is it only through screening that can be detected?
No, so there are signs and symptoms of cervical cancer.
Okay.
So one of them actually is the early stages. That's when you have persistent infection and maybe the presence of some precancerous lesion. You would not have any symptom at all. So again, we are emphasizing the reason why we need to screen. Okay. But then when you have advanced disease, which we don't want our ladies to get to, one of the signs may be that you may have something we call postcoital bleeding.
Oh.
Yes, so you bleed after sex.
Okay.
Okay, and the reason is that once you have a growth there and then you are having sex, the penis would hit on the growth, and the cells there are very friable, so they can break and then you can end up having bleeding. Another could be that you have foul smelly discharge from the cervix. It could also be that you could have some lower abdominal pain, which is, it's very severe in advanced stages. And once it advances, or the higher the stage, it spreads to other parts of the body. So based on the part of the body that it has spread to, you would have peculiar symptoms. So if it has spread to your chest, you may have difficulties breathing. If it has spread to your bones, you would have issues with walking and all of that.
Okay.
And then also the general outlook of the patient will look very cachectic or will look emaciated because it's a cancerous process that is going on. The patient will, because of the bleeding, the excessive bleeding, the patient may also be very anemic. So all of these
could be symptoms.
Yes, could be symptoms of.
The bottom line is get screened.
Get
From what age should women or girls be screened for this? From what age? Very quickly.
Okay, so from the ages of 21 to 39, you can have the pap smear done. Okay. But then it's also, WHO recommends that from the ages of 30 to 65, you can have either a pap smear and an HPV DNA PCR done.
Okay.
And based on the test, the type of test, so if you are doing a pap screen, it's every 3 years.
Every 3 years, okay.
And then if you are doing the HPV DNA, it's every 5 years.
I see.
Okay, and then beyond 65 years, once you've had a pap screen done and you've had clean tests for 2 consecutive times, then you are free.
You're free. You're good to go.
Yes, you're good to go.
All right. Now, how do people get in touch if they want to learn more? Can you go to any health facility to get screened?
So Medical Women Association of Ghana, it's an association that puts together all medical lady doctors across the country. And we are ladies, we have services. So we are better to understand what cervical cancer is, and then we treat it. So across the country, we are doing all of these education. And then at Korle Bu Polyclinic, we are having some free screenings there within this month, about 150 ladies. So ladies, find your way there. And in other hospitals as well, where we have the gynecologists, we also have some of the screenings going on there.
That's fantastic.
But the free screening is just at the polyclinic. In the other places, you might get subsidized fees, or you might pay the normal fees. Yes.
But it's worth saving a life,
yes,
right?
it is. It is.
Thank you so much, Dr. Kalsum Zakaria Adam, public health practitioner and national coordinator for Medical Women's Association of Ghana, and Dr. Anita Tibo, who's a family physician at the Korle Bu Teaching Hospital Polyclinic. Thanks so much for educating us this morning.
Thank you for having us.
I want to say a very big thank you to Lexter Ghana for being our partners in this whole drive. And also thank you so much to City TV for having us here. Thank you so much.
Thank you so much, ladies.
Thank
you. A word to the wise. All right. Now, they've given us some good information, and perhaps to start off the year, ladies, you could go and get your cervix screened.